I felt very engaged in what was going on. I have had surgery before, and there was a whole lot of talking going on, but they weren't talking to me. But in this case, I felt like right up until I didn't know what was going on anymore, they were engaging me at some point. If they weren't asking me my name, looking at my wristband, they were asking me which side, they were, what are you here for, patting me, asking me if I was comfortable, asking me if I was all right, or that kind of thing. And I just felt like, oh man, this is just the most wonderful thing in the world. I mean, it really, really comforted me and made me feel like I was participating, and I wasn't the patient on the table. I was dying. And if I found myself in another situation like that, I would have to compare it. And if it didn't turn out that way, I would be very, very disappointed. And unfortunately, I might be very verbal about it, but I would definitely let someone know. If I went to another surgeon, I think that's exactly what I would ask. Do you do this? Do you use the checklist? Tell me how it's going to be in there, for sure. I'm the mother of 3 children, and I have had several catastrophes happen with those children, from broken backs to stitches, and believe me, I would be asking that. For sure, I would be asking, do you use the checklist? I know how precious those little lives are and those big lives are, and I certainly would not want any of my family members to be in jeopardy. Back to that, letting those patients know that this is what it's going to be like. Tell them the truth and say you're going to have many people that are going to ask you over and over and over again what your name is, and they're doing it so we can keep you safe.